The timing is just impeccable. She's been sleeping all morning and has rocked up and said, all right, it's showtime. Hey, have you ever had a client who wanted to be fixed yesterday and at no cost? Would you like to? I'll repeat that. Have you ever had a client who wanted to be fixed yesterday but at no cost? I mean, these are clients who, they resist every suggestion or recommendation. They're skeptical, they're contrarian. And then at the other end of the scale, you've got the most perfect client. They've agreed to everything that you've recommended. They're practically trying to, pay you hand over their credit card even before they put their shoes back on. Have you ever had that happen? I can tell you, I sure have. And it's been a remarkable thing, because I used to wonder, why is it that some consults go so brilliantly and others are just pushing shit uphill? Is it me? Is it the client? Is it something else? Is it something I'm missing? So I went on a long fact-finding mission to learn how I could do things better so that my patients could make the best decisions for their health. And that's exactly what we're going to be exploring in today's Ttt TV show. We're going to make your professional life easier by exploring the three crucial keys to the perfect cruisy consult. First, let's allow me to introduce myself, or I can introduce Penny. Here she is. She doesn't want to play. All right. I'm Ted Jed in red, and I'm a specialist in manual therapies for the lower limb. I'm coming to you live from our beautiful home office of Jedynak here in sunny South Australia, and it is a glorious springtime sunshine day today. It's great to be here with you today, exploring topics I've spent over 30 years trying to get my head around. Throughout my career, I've had the great privilege of learning from some of the brightest and best minds in the business. It's certainly been a long, windy road, full of plenty of ups and downs, let me tell you. But it's been fabulous now to be kind of on the other side and giving back to health professionals like you so that you can shortcut your path to a successful and fulfilling career. Dr. Little and I are really excited because in 2 more sleeps, we depart for London and Europe, where we'll be delivering our sold-out FMT workshops. It's going to be fun to return back to the Northern Hemisphere again. There are so many dedicated health practitioners there keen to learn about manual therapies that can fix feet. We're going to be catching up with previous graduates of our FMT workshops, as well as meeting a whole lot of new faces. Can't wait! So, today's Ttt TV show continues with part 4 of a series of 5 episodes all about bunions. So get your cuppa sorted, because there's a mountain of gold that's coming your way today. We had a sensational response to last week's Ttt show, where we chatted about treating bunions, and these were bunions that had already been surgically fused. Special thanks to Dean Newman, physio over in Perth, for sending us his request, permission and details of a unique surgically fused first MP joint case. He's currently seeing this patient in his practice, and we talked about assessing and treating along the kinetic chain from the first MP joint right up the kinetic chain that's related to the first MP joint, using tools like these, stainless steel tool-assisted massage tools that help release connective tissue restrictions and restore joint function and myofascial, releasing those fascial densities. If you haven't caught up with that Ttt show, you can still find it here on this foot mobilisation Facebook page. Also, special shout outs to Robert in Murray Bridge, a regular listener and contributor. Also, Kirsten, it was great to have your contributions for last week's show too. Thank you very much. In today's Ttt show, we're crossing over to the dark side of patient management. As we discussed in last week's show, it's one thing, to have all these great skills and expertise and information about what treatment options you've got, and you can have all these resources coming out your wazoo. But what if your patient doesn't take up your recommendations? I mean, at the other end of the feet that we're doing our best to fix, there are patients who may not be the most compliant. I mean, they may be skeptical, they may be negative, or even uncooperative. They might even have considerations about time or money involved. Look, if you've had a patient who has expressed concern about time or the cost of their services, please give me a thumbs up or maybe a sad face to float along the screen so that I know we're kind of dealing with some people who have similar characteristics. Okay, so in today's show, we're going to have Penny Lee. She's going to be helping us to explore 3 crucial keys to have your consults go as smooth as silk. Penny, this one's your glass here. No, that's right, that's my glass there. Okay, we've got it all sorted out now, haven't we? All right, so in today's show, I suppose before we get stuck in, a quick word from our sponsor. Today's show is proudly brought to you by Crazy Cat Productions. Coming this way for a drink? She's going to do something crazy. I got the feeling in my water, and who knows as well. Penny has a joke for you today, and that is, what do you say to patients who complain of heel pain for the first 15 minutes after they get up out of bed in the morning? Going to tell them? Get up 15 minutes later. Hey, now what kind of solution's that? Yeah, that's a Crazy Cat solution. Okay, enough madness, don't you think, Penny? Oh, she's really taking a drink there. Okay, so let's jump into today's Ted's Tips on Tuesday. And our topic is... Look! There it is. Fly! That was a special little gift from Penny here. She's been helping me with our packing for London, and there is a great little cylinder cap that she loves. So while she's amusing herself, today's Ttt T show is Busting Bunions, the 3 keys to the perfect bunion consult. By the end of today's show, you're going to be crystal clear on the crucial ingredients for a cruisy consult. My goal today is to make your life easier. I don't know about your life, but it's certainly going to make our practitioners' lives easier with your very next client. So straight after this show is over, I guarantee you're going to have some top tips to be able to apply immediately. Doesn't matter if they're bunions or if they are coming to see you for some other reason. It's going to work for you. I'll just give you a little bit of background as to how this topic came about. Remember Dean from Perth in the Wild West, physiotherapist? He's also got a couple of practitioners, Philippa and Matthew, working with him. You see, Dean, he messaged me about a case, and it was the case where the first MP joint had been surgically fused. In Dean's message, he wrote a crucial line, and that was, how do I convince this patient of the best way forward? Now, I certainly understood where Dean was coming from. As a practitioner, you're confident of the best way forward for a patient, but how do you get a patient to understand what that direction is and then to take up your recommendations? You see, in that situation, it can often feel like you're trying to have to convince them to do something for their own good. Now, unfortunately, trying to convince a patient of the best way forward, it rarely gets the best outcome for you or for your patient. Now, let me explain. It's a little bit like visiting a new dining restaurant or dining establishment for the first time. You've got a waiter who tells you about his favourite dishes or specials. It might even go into great detail about every dish and why he thinks they're the best. But the waiter hasn't even given you time to really look at the menu. You don't know what you actually feel like eating, or in fact how hungry you are, or you might not even like the decor. But then there's this, waiter who's kind of leaning over you. Obviously, he's, look, he's passionate about food, and he wants you to enjoy the restaurant. But no, it's just actually getting a bit annoying. You start to think, maybe this waiter's just trying to flog you something, something that's been unpopular, or maybe he's angling for a big tip. Does he, just want to hurry you out so he can get ready for the next sitting to sit in your table? The more the waiter tries to convince you of what dishes to eat, the more you can kind of feel yourself backing away. And it's almost like the hairs on the back of your neck start to rise, and you think, maybe the waiter's got good intentions, but even so, you may start to question his integrity. Like you lose confidence, or you even begin to regret coming to the restaurant in the first place. I mean, you look at the prices, and now they actually seem more expensive than the longer the waiter keeps hanging around, and you really start wondering, well, maybe you should just leave and never come back. You see, when you have someone trying to convince you of something, even if it's to your benefit, something inside you resists that advice or recommendation. I mean, we could consider this crucial point in terms of Mary Parker Follett, a famous, she has well renowned for this concept referred to as power over versus power with. Have you ever heard that concept? Just Google Mary Parker Follett, surname Follett. Power over versus power with. Look, it really is a game changer for you and for your patients. It essentially sums up how I've worked with patients for probably the last 30 years. Power over is kind of a traditional relationship that requires force and manipulation. You see, in this scenario, dominance and coercion, they're often used time and again before other alternatives are considered or sought. Look, it has many negative connotations such as repression, force, corruption, and abuse. Power is seen as a kind of a win-lose relationship. Now, your patients, consciously or unconsciously, are highly sensitive to this kind of relationship because it's repeated in personal relationships, in personal communities, institutions even, over and over again. But power with does not rely on personal force of any kind. It requires skillful expression of external realities married with the interior aspirations of others, namely your patients. You see, power with emerges organically, and it comes from the relationship you have with your patients. It's about finding common ground. It's about having a sense of collaboration towards a mutually beneficial end. It's about feeling like you and your patients are on the same page, and that you're wanting the same outcomes. I mean, it opens up possibilities of joint action. In other words, you and your patients are respectfully going to work together to collaborate to get this problem fixed. Okay, so that's all well and good, Ted, and thanks for sharing. But how does this actually work in a real-world consultation? Well, that's what we're going to be exploring today. Today, we're going to unpack the crucial elements of the cruising power with consultations, and we'll apply these elements specifically to first MP joint conditions. You'll be able to use all of these elements for all of your conditions. Whatever the consultation, whatever the service you're looking to provide, all these elements will apply. Now, the first crucial key is context. Now, context is defined as the circumstances that form the setting of a statement, idea, so that it can be fully understood. This is really important to appreciate because it'll give you a more complete understanding of how you can help your client. The crucial contextual element is what is important to your client. A question that I like to ask in my consultations is this. Tell me, Mary, why are you here? Now, don't be fooled by the simplicity of that question. Now, let me ask you, why do your clients come to see you? Is it for pain relief? No, I can tell you that right now. Believe it or not, your patients, they might think they're coming to see you for pain relief, but they're not. Rather, they're coming to see you to play golf or dance on the dance floor again, or play with the grandkids, or here locally we've got our annual fun run. The City to Bay fun run is happening literally next weekend. So, people are, it's often a busy time for clinics because people are training and they're injuring themselves. They're not coming to specifically to get pain relief, they're getting because their goal is to run the City to Bay run with their teammates. That's why people come to see you. This is what's significant and important to your client. That's what you need to identify. It's, if we go back to the dining establishments, Lil and I, we've got a favourite restaurant here, cafe/restaurant called the European. Why do we go there? Do we go for fuel for our bodies? Well, yes, of course, but we want to eat more about we want to have more of the experience. It's an Italian restaurant, and it's like Mama's home cooking there. Deborah, who's often at the head of the restaurant, always check out my boots. It's like we have a whole range of experiences that take place when we go to the European. We probably drive past about 70 dining establishments to get there. And many of them are Italian as well, but we go past them just to get to the European. Do you do this? Ask yourself, is it really about the food? Like, as good as it is, or is it about something else? Dean's client from last week, yes, she's now getting lateral foot pains and lateral foot leg pains, and that's what Dean's looking to treat. But what's important to her? Well, she wants to walk comfortably to build up her fitness. Also been advised she needs to build up her heart health, and she wants to build up her fitness so that she can do her travel to Europe. You see, there are plenty of people who are out there, they're suffering from pain, sometimes even chronic pain, and they're not walking into your clinic for help. And it's not until the pain stops a person from doing something that's really important to them that then they end up in your consulting room. Then it's your job to find out what is the motivating reason. And this is going to be crucial throughout your relationship with that patient. I'll explain why in just a moment. You see, another reason why context is so important is because it helps you to establish your treatment recommendations appropriately. You see, clients, they can't see beyond what they don't know. They operate from what they think they know. And now with Dr. Google, how many of your clients will come in with handouts and printouts of, I've done all this research and, this is the self-diagnose their problem and know what their treatment's supposed to be. This is, you've got to watch out for this because they think they know all the options and they will only work within that paradigm of what they know. If we go back to the European, I know their menu pretty well. Got a favourite dish, polenta di verdura. I'm thinking, this is my favourite dish, and I look at the menu, and it's not on the menu. There's no polenta verdura. Perché allora? However, Deborah, who was attending to us, she said, don't worry, I'll get it made for you. She was going to go to the kitchen and get this, not on the menu, but this is the kind of relationship that we have, is where the kitchen and Mama's cooking will happen just because I asked for it, and that's a part of the special experience. You see, let's think of Dean's patient. Dean's patient went to her GP, So her GP, a trusted advisor, told her, you need to go to orthopedic surgeon. So she goes to the orthopedic surgeon. Surgeon says, all right, what you need to do is have this surgical procedure. And interestingly, the patient's mother had also had a bunion surgery. So in her mind, this is what she knows, is that for this type of problem, well, I need to have bunion surgery because that's what my mother's had and that's what my doctor said and that's what the surgeon said. Think of plantar heel pain cases. How many patients think that orthotics or cortisone injections are the only options? Maybe you think that they're the only options that are worthwhile for plantar heel pains. You see, if you're going to offer an alternative treatment that your patients don't know about, you need to bridge the gap of where they are to where you need them to be. In other words, this will require some education, keeping your communication simple and straightforward so that they can get along that journey. You see, if we take Dean's patient who, after the surgeon had finished with it and said, well, you know, my job's done, now you need to see a physiotherapist, she thought, well, maybe I needed more surgery because the problem hasn't been fully resolved. And now Dean's caught in the situation saying, well, no, the surgeon said you don't need more surgery. Oh, I need physiotherapy. So what does that mean for Dean's position? What does he need to do? Well, he knows that this is where his patient is and he needs to provide a treatment that she's not aware of. How is he going to get this patient along this journey? And he might say something like, well, I've done some advanced training in some tool-assisted massage techniques, which has been shown to reduce the need for surgery. And it kind of works a little bit like massage, but it's more specific and more accurate in releasing these type of adhesions that form particularly after surgery. Make sense? Great. Now, the third element of context is patient expectations. You see, meeting or exceeding expectations is the key ingredient to cruisy consults. If you only get one thing from today's show, that would be it. Meet or exceed your patient's expectations. To achieve that, you've got to know what their expectations are. Like, what do they want? In the case of the bunion, they might want pain relief. Maybe they want reduction of size. Maybe they've got some bony enlargement here. Maybe they want straighter toes. Maybe they want the foot to be able to fit into their favourite shoes. Maybe they've got the daughter's wedding coming up. Like, you've got to know what's important to them, what's in their mind that's going to help, that's going to be significant, their significant emotional event. I've had businesswomen who've told me that they didn't want orthotics because they didn't want to give up their heels. And you know, sometimes the corporate women in the corporate world, part of their presentation is important to have great attire. So orthotic therapy may not be the obvious choice or the choice that they're willing to accept. So clearly understanding your patient's expectations and what's important to them is crucial to a cruisy consult. You'll then know right from the start what expectations you need to meet and what expectations you'll need to manage through simple and skillful communication. Okay, so that's context. Now for the crucial second key for cruisy consults, and that is communication. What we say, how we say it, all crucial elements, aren't they, P? It's a poor penny that came here. All right, yes, good. And so this is what happens with a cruisy consult. Everything works pretty smoothly, doesn't it? Oh, yes. Nice work, Penny Lee. Okay. Now, the crucial thing here is what we say in our consults, and specifically the quality of questions that we ask. Now, this is crucial because the answers that your patients give you are the insights into what's truly important for them. I ask all my patients this question, and that is, if you didn't have this problem, whatever the problem is. So if it's a bunion trouble or a first, big toe problem, if you didn't have this big toe problem, what would you do? What would that mean for you? By asking this crucial question, you get to understand your patient's aspirational desires. If you do nothing else from this Triple T show, I know this is the second thing, but this is absolutely crucial. Make sure that you ask that question of your patients. It truly makes a world of difference, especially when you link your patient's aspirational desires directly with your treatment solution. If I think of Dean's bunion patient that's had surgery and looking at fitness and walking and travel to Europe, I'd say something like, Mary, to get back to your walking fitness level and to get your heart fitness up so you can get on the plane and really enjoy Europe, here's what we need to do to achieve those goals. Or if we've got a golfer, Jim, to get you back on the golf course, playing 18 holes pain-free, here's what we need to do to get you there. Did you notice how I used a 4-letter word? Remember, see what that 4-letter word was? It was need. N-E-E-D. Remember that word from a previous Triple T show? If not, go back to it, because it is worth its weight in gold and has such an impact, like many other 4-letter words can too. This is a key example of what I referred to in the show before as far as power with versus power over. When you're in the undesirable position of feeling like you have to convince your patient that your treatment recommendations are the best course of action, that makes it tough. It's like you're going to be pushing uphill. When you operate from a power with perspective, you'll never have to convince your patients of anything ever again if you understand the context in which they've come to consult you with. And that is their aspirational desire. What is it that's important to them? And by linking what's important to your patients with your treatment solutions, your patients will then feel as if you're on their side. It's like you understand what they need and you're literally speaking their language. The next key element of communication is using analogies. Now, this is very important because it makes it easier for your clients to understand your message. I can remember a new graduate, probably even for a few years after I graduated, I was notorious for using long, multi-syllabic words, if that's a word, if that's how you pronounce it. I've lost track. But, if someone had onychomycosis or, plantar fasciitis, or, if there were long words, I'd pronounce all of the syllables and, so I could show them that I was important and I knew and I was educated and knew what I was talking about. And sometimes I would get caught up in what I was saying and what impression I was trying to carry on. Now it's like, okay, there's an infection, a fungal infection in the nail, or you've got this heel pain and it's a brute of a thing. My favorite analogy, particularly from treating MSK conditions and biomechanically focused conditions, is the use of a house renovation. Now, with reality TV, everyone knows about house renovation projects, and most people have experienced or endured a house renovation themselves. And so typically I'd say, look, you've got a bunion case, and the treatment, I might explain to Mary that this treatment is going to take time. It's a little bit like a house renovation, because what we have to do is get the old damaged cells replaced with new healthy cells. Now, in the joint structure, this is a cycle that normally takes around 6 weeks. It's a bit like a house renovation. We've got to kind of pull apart and tear out all the old materials so then we can rebuild and restore all the new materials. It's highly likely that potentially things may even feel worse before they get better. Just like a house renovation, when they start ripping stuff out, there's dust and crap and rubbish everywhere. But gradually we can get that rebuilt. So you've got to do that to get to the end result. Make sense? Like, that is something people can relate to. They understand what's going on. It's like, oh, okay, this is what I need to get some renovation happening with my bunion joint to get things better. Okay, makes sense. If we look at Dean's example of his patient with the first MP joint condition, I'd probably use another analogy, an example of saying, Mary, I'm calling her Mary, but I don't know if that's actually her name. So Mary, the compensations that are affecting this big toe of yours, think of it a bit like wheel alignment. The wheel alignment is out, and what's happening with your foot is the foot alignment is out. But with a car, if the wheel alignment's out and the steering's constantly going over, you're hanging on, you're kind of pulling the steering, your arms might get tired, it might be causing stress in the chassis. Does that make sense? Okay, well that's exactly what you're experiencing. The steering of your foot is going out, certain muscles are trying to pull things back into position, and this is why you're getting that pain on the outside of the foot and going up the outside of the leg. And this is pretty common with people who've had surgery like you. The good news is we've had great success in our clinic in treating people just like you. Now, the third thing is, she's wondering, are you actually going to be able to help me in my condition? And I'd say, technically, yes. But Mary, you're unique. The surgery you've had, the life experiences you've had have certainly made your situation unique. True healing will take time, and it will take some time to get you feeling better. But what I recommend we do is, while we're anticipating it'll probably take about 6 weeks to get full resolution, let's work together for 3 weeks. At the end of 3 weeks, we'll review your progress and then decide how we're going to proceed from there. Your body will respond quickest when we do a little bit regularly. Now, in your case, that will mean seeing you twice weekly for those first 3 weeks. Then, when we do our review, we'll look and see if we can reduce that frequency. Make sense? Great. Now, there is one other thing, Mary, you'll need to do, and that is there'll be some homework, some simple but important exercises. You can literally do the exercises while cleaning your teeth or watching telly. And that'll take about 2 to 3 minutes each morning, each evening. Does that make sense? Okay. Does that sound like it's going to be doable or achievable for you? Great. Cool. And then we would go into the details. So literally what I mapped out over the last few minutes is all of the steps that lead to the third crucial key for the Cruzy consult. And that is confidence. And confidence because rapport has been established via relating to what's important to them, by speaking their language, dealing with their aspirational desires, and communicating clearly through the role of using analogies and not complicating things with highfalutin multi-syllable words. Transparency is also crucial. You need to advise every patient about 1, what they've got, what's their problem. 2, whether you can or can't help them. And 3, if you can help them and you're willing to take on their case, what's it going to take in terms of time, money, commitments? Every patient wants to know these 3 things. What have I got? Can you help me? And what's it going to take? Answer those 3 questions clearly and succinctly while linking them to the reason why they've consulted with you in the first place, their aspirational goal, and you're well on your way to a collaborative outcome that serves your patients. So, to recap, those 3 crucial keys to the Cruzy consult are 1, context, so that there's a high level of relevance to your services and those services to your client. I can't emphasize enough how crucial that is. 2, communication, so that your client clearly understands the best course or courses of action for them and linking that to their significant activity or personal aspiration. And 3, confidence in you, confidence in your services and how you care for them. Remember the concept of power with versus power over. In other words, patients will have confidence in you when they feel like you're collaborating with them to get their desired goal. Patients will have confidence in you when you've communicated that you care. And when you've been transparent with your patients, answering the 3 crucial questions with clear, succinct communication, patients will respect you. Now, this doesn't necessarily mean that every consult from now on will be cruisy, now that you know this stuff. Rather, it's about stacking the odds in your favor so that you and your patients can achieve better outcomes. Make sense? These factors I wish I knew earlier in my career, because they've made patient management so much easier and so much more rewarding. I hope that this information benefits you and your patients too. Hey, if you've just joined us, we've covered a heap of Ted's tips today. It was all triggered off by Dean Newman, physio in Perth, Western Australia, and his physios Mark and Philippa, who had a very interesting post-surgical case where the first MP joint and the tailor-navicular joints had been fused. We've discussed 3 crucial keys to cruisy consults. Phew, what a show. Jam-packed with practical good stuff. Hey, all of the pieces are available for you in our free, fabulous freebie that we've got for you. Just hit the link on this post, download it, and it's all yours. We've got the 3 keys there: context, communication, and confidence, plus some Ted's tips highlighted down below for you as well. Any questions? Type them in, and I'll be thrilled to answer them for you and give you the best suggestions I can. Meanwhile, I see that thumbs up, thank you very much. Next week, we have got a spectacular show coming to you next week, live from London town in the UK. You see, what we're going to do is we're going to distill all 4 Ttt shows on bunions into one super summary spectacular. We're going to distill the first MP joint, as Guy here, the assessments and clinical differentials. We're going to go into the treatment options for first MP conditions without even touching the first MP joint itself. We're going into the third element is the treatment options for surgically fused big toes and other joints, just like Dean's patient. Plus, the world exclusive first training for the first MP joint conditions and MSK conditions of the lower limb using this tool assisted massage. It's going to be great because we're going to have some exclusive options for tool assisted massage online course that you'll be able to use in your clinics straight away. It is a world first, and I can't wait to chew the fat more on this awesome topic. So, Dean, thank you again for your request and contributions on how to treat bunions after surgery. Thank you all very much for joining me today. Let me know what you think of today's show. If it's, I know from my point of view, it's been a huge episode. Dr. Lil did a spectacular job this morning in packaging, refining, and organizing my brain ideas bucket load into a beautifully cohesive, coordinated lot so that you could get clarity and benefit and literally tips that you can apply in your clinic right now when you go back into the consulting room. Have you found it useful? If you have, please type in a comment or question down below. If you haven't already, please like this page, Foot Mobilization Techniques, on Facebook. If you've got a colleague who you think would benefit from having more cruisy consults, if you know of someone who's been bitching about, damn, these patients, they're such a pain in the arch sometimes, and then send this link to them, and hopefully that will be able to serve them and help them get even better clinical results for their clients too. So make sure you join us next week for Tuesday's Ted's Tips on Tuesday. coming you all the way from London town. We look forward to showing you my tips again. Woohoo! And this time, coming from the motherland. Been a blast today. I hope you've had a cracking good time. Remember, you're only one step away from busting bunions. So get your free download today, hit the link, and then I'll see you on the inside. You'll hear my voice as you read the freebie. Until next time, cheers.